our news, and we invite you to stay tuned now for a live press briefing from the Minnesota Department of Health on a day that saw another 43 deaths associated with the coronavirus outbreak, along with more than 5,000 new infections. But those numbers are likely skewed, according to health officials. Over the past weekend, case growth exceeded intake capacity for health department staff, resulting in a temporary backlog that is expected to impact newly reported cases for a few days. Any way you look at it, COVID continues to sicken Minnesotans at a high rate. And in just a moment, we'll get some details as to what might be going on and when this current surge might peak. From Health Commissioner Jan Malcolm, along with the state's infectious disease director, Chris Erzman, senior equity advisor to the commissioner, Dr. Nathan Chomolo, is also scheduled to be on the call today. On the national front, health officials said today the campaign to vaccinate elementary school-age children in the U.S. is off to a strong start, but experts say there are signs that it will be difficult to sustain the initial momentum. The White House says about 900,000 kids, age 5 to 11, will have received their first dose of the COVID-19 vaccine in their first week of eligibility, providing the first glimpse at the pace of the school-age vaccination campaign. More on vaccinations and the rest from the Health Commissioner, Jan Malcolm.
77 new cases and 43 deaths. On the case numbers, we'll talk about this further in the call, but some of those numbers for today do reflect the very large uptick in cases that we've seen that is affecting the case intake and verification process. Our pandemic totals now are at 831,669 lab-confirmed cases and 8,925 Minnesotans whose lives have been lost to COVID-19. There are currently 1,159 patients hospitalized for COVID, which is another record high day for the whole year, 2021. Including 257 patients in ICU. Capacity remains tight, in fact, continues to tighten further for beds across the state. We now have 74% of Minnesotans age 12 and up who have received at least one vaccine dose, and 71% of the 12-plus population who completed their vaccine series. If we look at the entire vaccine-eligible Minnesota population, now down to 5 and up, we have 67% of the state who have received at least one dose. Before we go deeper into the briefing, we really want to talk some more about these extraordinarily high and concerning case and death numbers. We've been talking about the Delta wave since midsummer, but right now we find ourselves in a really truly alarming spike in cases in more recent days. Our exhausted healthcare workers and our exhausted public health workers continue their truly heroic efforts to protect Minnesotans. But every day now, we're seeing dozens of Minnesotans dying from an illness that they didn't have to get. And that is beyond heartbreaking for all of us doing this work. The tragedy of this current spike in cases is that more than ever, we have the tools and the knowledge to minimize the impact of this virus. But a sizable number of people here in Minnesota and in other states are not using those tools. Some because they mistakenly think COVID is over or it's no big deal, or some because they're just tired of it, done with COVID, as we say, and some because they have fallen victim to misinformation. So many of these cases, especially the hospitalizations and deaths, could be prevented if more people used those tools, by which we mean vaccination, masking in public, staying home when sick, and all of those mitigations that have served us well over the last 2 years. Choosing not to use those tools has a cost. Sometimes it's a cost the individual pays themselves, but often it's a cost that that individual passes along to someone else around them or someone they will never know, unknowingly passing the virus, particularly as we have talked so often about asymptomatic transmission. This spike is bad, it's scary, but it would be so much worse, especially with many, many more hospitalizations and deaths. It would be so much worse if it weren't for the fact that most Minnesotans now do have the protection of the vaccine. but many people, close to 40% of our state, are still not protected. We need all Minnesotans to recognize the fact that in a pandemic storm like this one, caused by the Delta variant, individual decisions have implications not only for the person, but for their families, their communities, and in fact, the entire state. I'd like to make a quick update on the data issues that we noted earlier this week. I mentioned the new case intake backlog that formed over the weekend when the number of new cases, new lab reports coming in exceeded the processing capacity of our staff, which works hard to verify that the positive lab reports are in fact new cases. We still have a backlog, but we're making steady progress on it, and the staff are working extra overtime and working very hard to get through the backlog as quickly as possible, and we are lining up additional staff in anticipation that these case levels may continue. Of course, we all hope that Minnesotans can help us slow down the growth of those case numbers so that not only our capacity to keep track, but more critically that of our healthcare workers and our hospitals won't be as strained as it has been recently. And on another data-related matter, we have resolved the issues that came up with the automated vaccination data system on Monday. As you might recall from our communication earlier in the week on that, approximately 7,000 people who received an initial mRNA dose of Pfizer or Moderna, followed by a J&J booster, were incorrectly removed from the count of fully vaccinated people due to an issue with our automated data process. Those 7,000 people will be added back into the online totals in tomorrow's data. Also, under our automatic process, a person with one dose of J&J was correctly counted as fully vaccinated. However, when they got a second booster dose of J&J, our system incorrectly categorized that booster as a second complete series. As a result, approximately 32,000 people who received a J&J booster on top of a primary J&J were counted as two separate instances of a complete vaccination series. This has now been fixed in the programming logic and will be updated on the public dashboard tomorrow at 11 a.m. I'd like to just make a note that these issues illustrate how seriously we take the accuracy and reliability of the data we're sharing and our commitment to transparency. We know many people are watching the pandemic numbers closely, and we want to give you all the most accurate and up-to-date information we can. And when we discover an error, we will tell you about it and fix it as quickly as possible. Moving on to another recent development. With respect to the decompression sites that we've talked about, Governor Walz's directive that we do whatever we can to try to help take pressure off the hospitals by supporting long-term care facilities to take more of the hospital discharge patients that they typically would take. Governor Walz's office shared earlier today that we are opening today the addition of a second skilled nursing facility to act as an alternative care site as part of our efforts to help decompress Minnesota hospitals treating this COVID-19 surge. An additional emergency staffing team of 14 Minnesota National Guard members and 9 nurses from the Federal Public Health Services will treat patients at Good Samaritan Society Bethany in Brainerd beginning on Wednesday. This site will help to relieve hospital capacity specifically in central and northern Minnesota, and will have the capacity to accept 34 patients from area hospitals who are ready for hospital discharge but needing additional step-down care. The facility aims to take in patients who are eligible for transfer, so they don't any longer require acute emergency care, but they're not well enough to go home, such as those recovering from a surgery. Hospitals typically are able to transfer these patients to long-term care settings to continue their recovery and rehabilitation, but staffing shortages, which are particularly of concern in the long-term care industry, have really constrained the capacity for long-term care to take transfers as they typically do. Governor Walz announced an action plan last month to expand access to staffed long-term care beds so that hospitals can do those discharges and focus on treating the acutely ill patients that they are dealing with for COVID and other critical conditions. And with those updates, I would like to turn it over to Chris Erzman to talk about the upcoming holidays.
Thank you, Commissioner. As we come up on the end of the year holidays, we're finding ourselves, as the Commissioner said, at a really difficult point in the pandemic. Although vaccination numbers continue to rise and the recent authorization of vaccinations for kids 5 to 11 is encouraging, the highly contagious Delta variant is driving Minnesota's COVID case numbers to an alarmingly high level at the same time. Our hospitals remain crowded, and there are still many of our fellow Minnesotans who do not have vaccine protection. So with that in mind, that not all the good news is good news, we are encouraging all Minnesotans to think carefully about their holiday plans. CDC officials recently updated their holiday guidance to reflect the changed landscape that we find ourselves in. And I think the good news is that there are ways to enjoy holiday traditions while still protecting your health and the health of others around you. The updated CDC guidance is available online at cdc.gov, and it reflects the fact that multiple generations tend to get together to celebrate the holidays. And the best way to minimize COVID-19 risk and keep your family and friends safer is to get vaccinated if you're eligible. Remember, your vaccine protects you and it protects those around you, especially those under age 5 who are not yet eligible to get the vaccine. We have continued to promote a layered mitigation theme, and CDC's guidance does continue to do that as well. They also emphasize some other protective measures, including well-fitting masks over your nose and mouth if you are in public indoor settings, if you are not fully vaccinated, and even if you are fully vaccinated, if you're in a community that's experiencing substantial or high levels of COVID transmission. And that is all of Minnesota at this point. You want to keep in mind that outdoors is safer than indoors. You want to avoid crowded, poorly ventilated spaces. And certainly if you are sick or having symptoms, do not host or attend a gathering. And get tested if you have symptoms of COVID-19 or have a close contact with someone who has COVID-19. If you're considering traveling for a holiday event, visit CDC's travel page to help you decide what's best for you and your family. CDC still recommends delaying travel until you're fully vaccinated. The CDC site has a useful set of testing recommendations for those who are planning to travel. Remember that masks are mandatory on public transportation, including buses and airplanes. And as I said before, they are strongly recommended for people going to public indoor settings in counties that have substantial or high levels of community spread. That includes all of our counties in Minnesota, unfortunately. Given the COVID blizzard that's hitting us in Minnesota, it's a really good idea to wear a mask even if you're fully vaccinated. Or if a member of your household has a weakened immune system and is at increased risk for severe disease, or if someone in your family is unvaccinated. If you are gathering with a group of people from multiple households and from potentially different parts of the country, you should consider some additional precautions. For example, avoid crowded indoor spaces before travel, in advance of traveling, to further reduce risk. So let me just say that again. If you're gathering people from multiple places in the country, you want to think about some additional precautions before you get together to really reduce your risk, and that includes saying I'm going to travel in a week. I'm going to make sure that I'm not out and about before that travel. And it's a really good idea to take advantage of the extensive COVID testing options available to Minnesotans. so you can know your status and feel confident before you go. Getting tested before the holiday gathering is especially important if you have any symptoms or have been around someone with COVID. To learn more about your testing options, you can visit the state website at mn.gov/COVID-19. Testing and laying low before you go is also important for students returning from college for Thanksgiving. The best approach is to test a few days before you go home and, if possible, once you arrive at home. It's important to connect with family and friends, and no one wants to miss out on another holiday season. And I can tell you that last year, our family didn't get together for Thanksgiving. And this year, we're talking about what we'll do. And we have individuals in all of these categories, so the CDC guidance will be really helpful to us. So we don't want to miss out on the holidays, but at the same time, we certainly don't want to be someone who passes a potentially deadly virus along to a loved one. And I think all of us can reduce the risk and still enjoy our holiday seasons by following the guidance on the CDC website. And so I encourage you to check it out, and our family will be doing that as well. And I will turn it over to Dr. Chumolo for an equity update.
Thank you, Director Arisman. And I'll just add that as a father of a 4-year-old who's too young to get vaccinated, we are also following that guidance and putting steps into place to hopefully gather again. So thanks for sharing that update. Moving to Minnesota's most recent vaccination data by race and ethnicity, a reminder that the way this data is reported does lag. But as of October 30th, vaccine coverage with at least one dose among Minnesotans age 12 plus is highest among those identifying as Asian Pacific Islander, with overall first dose coverage rates of 82.8%. Black and American Indian communities have consistently seen the highest gains week over week, and their first dose rates among those 12 plus currently sit at 66.6% for Black Minnesotans and 58.7% for American Indian Minnesotans. First dose coverage for Hispanic Minnesotans is just shy of 70%, coming in at 69.9%, which is notably now higher than that for white Minnesotans age 12 plus, which is at 69.6%. Regarding our place-based equity metric using the Social Vulnerability Index, or SVI, over the last week, cases, hospitalizations, and deaths remain overrepresented in Minnesotans who live in zip codes classified as high SVI zip codes, areas where communities are at a disadvantage due to historical and persistent underinvestment. Though residents of high SVI zip codes make up 29% of Minnesota's population, they make up 32% of cases, 38% of hospitalizations, and 37% of deaths due to COVID-19 as of this week. And similar to the overall population, the impact has been greatest among children who live in high-risk SVI zip codes, with children younger than age 17 who live in high SVI zip codes in Minnesota experiencing 42% of all COVID-19 hospitalizations to date in their age group. When looking at vaccine coverage by SVI zip code quartile, coverage remains lowest among Minnesotans living in high SVI zip codes. However, several weeks ago, first dose coverage for Minnesotans in high SVI zip codes did hit 70%, and this week sits at 71.9%. compared to statewide first dose coverage, which the Commissioner noted is at 74.2%. One of the efforts that has played a critical role in our vaccine equity work has been bringing shots directly to communities via community vaccination events. MDH has done this in coordination and collaboration with community organizations, local public health agencies, healthcare systems, tribal nations, pharmacies, clinics, regional coalitions, and MDH's mobile bus program and COVID community coordinators. This week, this collaborative effort hit a significant milestone. Since February, over 1,000 community vaccination events focused on our Black, Indigenous, and other communities of color have been held throughout our state. This wouldn't be possible without our community partners who have provided COVID-19 vaccines creatively and thoughtfully around the state. Barbershops, elementary and high schools, community colleges, concerts, county and state fairs, food shelves, homeless shelters, housing complexes, Head Start sites, YMCAs, professional sports teams, casinos, car dealerships, libraries, community centers, churches, the Minneapolis-St. Paul Airport, and numerous other sites have stepped up to help us reach communities hardly reached. And as a result, we have seen several of the gaps in first dose coverage in our BIPOC communities that existed early in the vaccination campaign close significantly. On May 1st, the first dose vaccination rate for age-eligible Hispanic Minnesotans was 41.2%, 17.7% below the statewide rate on May 1st, and for Native American Minnesotans, it was 16.5%. However, at the start of November, the gap for Hispanic Minnesotans had shrunk to 3.7%, a 79% decrease. For Black Minnesotans, that gap has dropped 66%, and for Native Americans, it has decreased 10% since the beginning of May. We've also seen an ongoing decrease in the first dose coverage gap between eligible Minnesotans who live in high SVI zip codes and the statewide coverage rate, with a decrease of 31% since May. While wanting to take a moment to recognize the incredible amount of work that has gone into closing these gaps, we recognize that there is still much work to do. Only an estimated 31% of eligible unhoused Minnesotans have received at least one dose of the COVID-19 vaccine, and only an estimated 27.4% of eligible Minnesotans who have been in jail at any point in the last 3 months have been vaccinated. To better reach these parts of our community, the state of Minnesota has worked with the Minnesota Council of Foundations to provide organizations serving unhoused Minnesotans with $300,000 in funding to allow organizations flexibility to determine which incentives and approaches would most resonate with the communities they serve. This has resulted in traditional on-site incentives like Visa gift cards, as well as cash, food, educational materials, and transportation. And through a $100,000 grant from the CDC, the state has also established a trusted messenger program that supports the development of a peer counselor model of engaging with Minnesotans in the unhoused community. I will finish by putting on my DHS Medicaid Medical Director hat to share an update on COVID-19 vaccination among Minnesotans covered by our Medicaid program. Our COVID-19 vaccination snapshot looks at the status of age-eligible Minnesotans enrolled in medical assistance, Minnesota's version of Medicaid, and Minnesota Care, our state's basic health program. Together, Medicaid and Minnesota Care make up our Minnesota Health Care Programs, or MHCPs, and currently cover over 1.39 million people, more than 1 in 4 Minnesotans. And we are doing better in first dose coverage among Minnesotans covered by our MHCPs. Our most recent data looked at all our enrollees age 12 plus who were enrolled as of September 30th and showed 50.8% of eligible enrollees had received at least one dose, up from 40.4% at the end of June. However, this remains far lower than among Minnesotans as a whole, and this disparity is seen in every age, racial, and ethnic demographic group. We are continuing to engage communities, tribes, Medicaid providers, counties, managed care organizations, and our colleagues at NDH about the gaps this data shows on ways to help get Minnesotans on Medicaid access to information on and vaccination with this life-saving vaccine. Our updated Medicaid COVID-19 vaccine data snapshot can be found on DHS's Medicaid Matters page at mn.gov/DHS/Medicaid-Matters, where you'll be able to see further details about vaccination rates among MHCP enrollees by age, race, ethnicity, disability waiver status, county, and social vulnerability of residential zip code. And with that, I'll give it back to Mike.
Thank you, Dr. Chumley.
You are listening to a live press briefing from the Minnesota Department of Health on the coronavirus situation in the state. From NPR News, reporters are getting ready to ask questions.
Press the pound key. Our first question comes from the line of Kate Raddatz with WCCO-TV. Your line is now open.
Thanks for taking my question. Commissioner, you're calling these cases alarming, scary. Obviously they are dramatically higher than what we've seen, throughout the year. Is there a point at which the state would have to or is considering stepping in with more guidance if people still won't take that multi-layered approach, or we keep seeing these case numbers go up and the hospitals are stressed?
Well, Kate, it's always a good question, and I think, as the governor has said many a time, we believe that the power to change this is in Minnesotans' hands. That we all have much more knowledge than we did when this all began, and we've got better tools now, particularly in terms of vaccination and some excellent accessibility of vaccination around the state. So we feel as though our main job right now is just to keep helping Minnesotans to understand that this is serious, it's not over, how very effective these vaccinations are, and as Dr. Trumolo just went over, how important it is for us to be working directly with communities to get the vaccines deeper into our communities, and also to get the right people, trusted messengers, talking to community members who have questions about the vaccines, that people they trust, their physicians, community leaders, faith leaders, and the like. So we're still very much in the mold of trying to get the information out there, trying to make sure the resources are readily available. I think, as the governor has said, he is eager to work with the legislature on any statewide mitigations that might make sense given where we are at any given time in this Delta surge, particularly. And he has made some suggestions to the legislature to that regard, that there are some things that we had in place last year to give flexibility and capacity and so forth that would be useful to have right now. But that really is a legislative discussion at this point.
Great, thank you.
Our next question comes from the line of Jeremy Olson with the Star Tribune. Your line is now open.
Hi, I wanted to talk about the latest wave in the context with waning immunity from prior vaccination or even infection. Commissioner Malcolm, a couple weeks ago you noted that waning immunity seems to start at 6 months, although it doesn't fall off a cliff, as you had said. But I was wondering if I could get more specifics on how you look at this. Is the working assumption that all people now are getting waning immunity at some level after 6 months? I'm just wondering more of your thoughts on that and how it's contributing to the latest wave.
Well, thanks, Jeremy, and I'm going to ask Chris Erzman to chime in on that as well as Dr. Tromolo, if he might have some insights from his own practice perspective. There is growing consensus, I would say, among state health officials and clinical leaders and research leaders that waning immunity does have something to do with this most recent wave, that we're starting to even see potentially some additional resurgence at the nationwide level after a number of weeks of seeing pretty steady declines in cases. And I think that goes right to the importance of the booster recommendations that have come out in recent weeks, and really encouraging people for whom it is recommended to get a booster to do so. That the protection, and Chris can comment on the data if she would like. It's pretty clear does wane over time, and we think that. A lot of the breakthrough cases that we're seeing in Minnesota and in other states are among the people who were vaccinated the earliest. Chris, would you like to comment any more?
Yeah, I'll reinforce what the commissioner said, and that is that yes, we do see in our data, evidence that there is some level of waning immunity, both when we look at the days from the last dose of vaccine in our breakthrough cases, as well as when we consider that the average age of our breakthrough cases tends to be older, and our elder population was the first vaccinated. But when we look at the time from serious completion until when we might start to see breakthrough cases, it tends to be right around 6 months. And certainly, we've talked about when we look at vaccine breakthrough, there are some confounding factors like age and the timing of the vaccine and things like that. But certainly that 6 month time frame is where we start to see a drop off in vaccination. And so just to kind of re-emphasize what the commissioner said, that's why we're really encouraging people that are eligible to take advantage of those boosters. But I also want to acknowledge that while it's so important for eligible people to get their booster, I think it's also really important to acknowledge that people who have not been vaccinated have no protection. So we're talking about a reduction in protection as immunity wanes over time and the importance of boosters. But please remember that people who have not been vaccinated have no protection. So we want to make sure that both of those important messages are getting out. Over.
And a follow-up related question to that. I mean, and I'm on a little shaky ground here, but when I look at the available breakthrough infection data, it looks like week over week now, numerically, more of the COVID deaths are in the vaccinated than the unvaccinated, even if proportionally the rate of deaths is much higher in that smaller universe of unvaccinated people. I only bring that up because I keep hearing people say that this is a problem of the unvaccinated. Even the HHS secretary said that in Rochester this morning. But I can't help wondering if that's really still a true statement. And if it isn't, then do the vaccinated need to be doing a little bit more than they're currently doing to protect themselves?
Well, let me start with your last question, and then I'm going to ask you to restate the first part of your question because I didn't fully get it. But in terms of should the vaccinated be doing more, I mean, I would say yes. I think during the spring and at the beginning of the summer, we were really excited, those of us that were vaccinated. We were really excited. We had been vaccinated. Our case numbers were going down, and we really felt like we were invincible. And I'll include myself in that, although I probably was a little bit more cautious. But then again, I'm probably not the average Minnesotan. But the bottom line is we really felt like we were in a different place. And so some of that mitigation just felt like, hey, that was so last year. I'm vaccinated and things are better. But at the same time that all those things were happening, that was when Delta really started taking off in Minnesota. And Delta has changed the landscape. And so, yes, it's really important that all of us, including those of us that are vaccinated, layer our mitigation. And obviously the most important foundational layer is vaccination. But we want to add to that, and we want to make sure that we're masking, that we're testing as appropriate, that we're, distancing, when possible, and that we're, washing our hands often. And then if you want to restate that first part, what you were saying about the deaths.
Well, I don't want to hog the questions for other media that might have questions. My point was that it looks like numerically each week more of the COVID-19 deaths in Minnesota are in the vaccinated people rather than unvaccinated people, even if the rate of deaths is higher in the unvaccinated people right now because they're a smaller number of people. So that I was just pointing out what appears to be that statistical reality, which in that place it makes it hard to say this is just a problem of the unvaccinated. I'm happy to just ask that more offline if other reporters have questions. So.
Sure. I'll just say, and we can talk about it offline, Jeremy, but I'll just say this. I think that we have acknowledged that vaccinated individuals have become collateral damage in the blizzard of COVID that we're seeing, and in particular in our long-term care facilities as we see additional cases there. Over.
Thank you.
And I'll just add maybe 2 points. One is that the question of immunity is going to be a shifting target as long as we're in a global pandemic where we could see, as Director Erzman noted, the emergence of a new variant, which would then change the calculus on the effectiveness of vaccines and everyone's protection. And so I think keeping that idea of global equity and what we need to do to achieve that, to really for our own self-interest, is really important. And then I've never been a fan of the pandemic of the unvaccinated, because amongst the unvaccinated are kids and who don't have access to shots. And so I think, and many families are mixed, and communities are mixed with folks who simply don't have access to that. And so I'm, as a parent of one, very much impacted by the fact that my unvaccinated child doesn't have access yet to a vaccine. And so And so I think it really is important to think about the potential complications to everyone that the pandemic of the unvaccinated, while we see that in kind of hospital stats, it really is impacting everyone. And I agree with what Dr. Ehrman said about being more cognizant of the precautions that we are taking, particularly as we're moving more indoors.
Thanks for taking all my questions. Appreciate it.
Our next question comes from the line of Catherine Richard with Minnesota Public Radio. Your line is now open.
Sure. I guess I'm hoping to get a little more detail from Chris on why we are seeing cases go up again. I mean, I know you guys have said Delta is really transmissible, not enough people are vaccinated, but that's been the case for months now. I mean, we seem to be going down, and now we're going up again. What is changing at this moment? Why is this happening right now?
Well, I'll certainly offer if the commissioner wants to start, but then I don't know, Commissioner, if you want to make a comment, but I'm happy to.
Well, I would my only contribution here, I think, would just be we think it's just a confluence of factors. It's the combination of waning immunity among some of those first vaccinated that we were just talking about. It's the relaxation of mitigation by a lot of people in a lot of circumstances, a lot more circulating going on without masking and so forth. Cold weather, more indoors, and I think just some of the patterns that we see that frankly are not terribly easy to explain about why does one state go down and then go right back up, and others, who have been in good shape for a while are suddenly spiking again. So there just are some anomalies to this virus that we just don't fully understand yet. But I'm sure Chris has a much more rigorous explanation than I do.
No. I mean, I absolutely agree with that. It is a confluence of factors, as the commissioner said. And then I think what we have to think about is that, you start building. And so you've got a lot of transmission and it just keeps building. So I realized that, there was maybe a week or so where things looked better, but all in all, when you look at the data, over the last number of weeks, I mean, it has just been, in general, a steady uptick in cases. And I think that, that's because the more cases there are, the more virus is circulating. It's unfortunately, it feeds itself, I guess, in addition to all the things that the commissioner said, that the additional cases beget additional cases. And as we've talked about, Delta is so much more infectious that by the time you're at the third generation, you have seen a lot of disease transmission, and that's not helping us at this point.
Okay, thank you. My second question is, what's the timeline for the vaccines being approved for children 5 and under?
What we've heard is that, maybe in early 2022. Obviously, they need to have the sufficient data. Dr. Chimolo might have more information on that, but what we were hearing was early 2022.
Yeah, I would add that my understanding is Pfizer had planned to submit data next month, potentially, for the 2 to 5 year olds, and then in early 2022 for the 6 month to 2 year olds. And then from there, it goes through the usual steps after data submission. So that timing sounds right to me, Dr. Director Ehrman.
Thank you.
Our next question comes from the line of Tiffany Bui with KMOJ. Your line is now open.
Hi. So the data on race and ethnicity shows that there's continuing disparities for POC groups that are contracting COVID-19, specifically Black, Latinx, and Pacific Islanders. I understand that you mentioned a lot of, initiatives to get BIPOC vaccinated. I'm wondering, what kind of barriers are existing that we're still seeing these pretty high disparities.
Dr. Chumel, do you want to lead off on that one?
Yeah, and so to be clear, you're asking about disparities in rates of infection, however?
Yes.
Yeah, and so we do continue to see those disparities as well, and those are, like we've talked about before, related to the many structural issues within society, structural inequity and structural racism that put our BIPOC communities at a disadvantage when it comes to what we know increases spread and severity of COVID-19. And so continuing to be on the front line, particularly as we have less, mitigation measures in place. No masking is intermittently required in different businesses. Folks who have underlying health conditions because of a longstanding disparities in access to health care, nutrition, environmental exposures, all those things continue to persist. We haven't fixed those, with the vaccination campaign. And so, but then when you add on that there are vaccination disparities, you see these persistent disparities with case rates. And so I think, we're very much continuing to use the kind of vaccine equity metric that really help target other resources within our COVID-19 response, whether it be things like testing to really help target some of these disparities. But this is kind of ongoing work that will take us continuing to show up in community, not just for vaccination, but to meet the other needs of our community.
Operator, we have time for one more question.
Thank you. We have our last question coming from Alex Jokic with KSTP. Your line is now open.
Thank you so much for taking this question. On the topic of hospital capacity and the new alternative care site opening today, the bottom of the press release from the governor says that MDH is working to determine facilities best suited to expand this program. Can you talk a little bit about what the plans are as far as potentially opening more facilities like this and how that will help our current, hospital capacity issue?
Thanks for that question. This is Commissioner Malcolm. We're really grateful that a number of facilities have expressed an interest, willingness to evaluate this and be evaluated in terms of the fit geographically and just in terms of the facility's capacity. But I'll just be really very honest here. The limiting factor is really the availability of staff. We are, as mentioned, this site in Brainerd opening today is being staffed by a combination of National Guard, who have been trained as temporary nursing assistants, and a team of nurses from the Public Health Service federally. And there are just, there aren't infinite numbers of either of those. So we're looking at where is their need, where is their capacity, but then trying to get the staff to come in, because this is all about increasing the staffing in those facilities. Very few facilities, like none, are able to take more patients without supplementary staff being provided. So that's a piece of the puzzle that is just, frankly, really a challenge with the national workforce shortage that exists, and with a lot of states now in the same boat of needing some of those emergency workers. So the competition for that resource is pretty tight.
So you don't anticipate in the next week or so that you would announce, or the state would announce, more of these are opening?
We're certainly continuing to evaluate it, but I don't think we're close to opening another one in the near future.
And then just final question on this topic, but If you could talk perspective-wise as far as hospital capacity, obviously it's been pretty low in recent weeks and months. I think it's like 2% of ICU beds available in the metro right now. Is there any insight you can give on the status today versus a month ago versus 3 months ago? Is today much worse as far as hospital capacity, or where are we currently? So people have a big picture understanding.
Well, yeah, you're absolutely right that capacity has been tight for quite a while now, and that's part of the issue. Is just the kind of the unrelenting nature of the pressure on our hospitals and our long-term care facilities. That the staff are just extraordinarily worn out, and so the problem kind of builds on itself as people just need to, reduce their hours, take a break for their own health and so forth. We do have more COVID cases. The number of people in hospitals for COVID is the highest it's been all year. So in that respect, COVID is absolutely making the situation worse. But as we've also talked about, and you've heard from hospital leaders directly, they're very full of other critically ill patients. And there's a lot of folks in the hospital now whose chronic conditions have not been as well managed in the last couple of years because of COVID, because of disruptions in access to care and their own concerns about seeking care. So it's a whole bunch of things going on at once. But the fatigue of the workforce, leading to people reducing their hours or even, retiring, finding other less pressure-filled lines of work that's an ongoing problem, unfortunately.
Thank you very much. That's it from me.
And that is it for today's conference call from the Minnesota Department of Health, airing live here on MPR News. I'm Stephen John. A lot of ground covered today from Health Commissioner Jan Malcolm, Infectious Disease Director Chris Erzman also on the call today. Malcolm starting out with the usual reporting on the case counts, etc., and added that 67% of the state now, including those as young as 5, have received at least one dose of the vaccine. But we're seeing some, as she said, alarming spikes in cases, and Malcolm said it is preventable. With vaccination available, other mitigation tools like masking and the like, but she said that maybe people are just tired of it or think it's no big deal or are succumbing to misinformation and choosing not to use those tools. And that has a cost that is playing out now, along with the waning immunity. Of course, you've heard about booster shots. Because of that situation, a question was put to the officials about, well, what's the deal? Is waning immunity really contributing to the case growth? And they said, yes, most likely it is. But as Chris Erzman also added, that the more cases there are, do a lot to the highly contagious Delta variant, the more the virus is going to hit other people. So that kind of feeds itself, as she said. Our Catherine Richard put it pointedly, what's going on? Why this spike in cases? And Malcolm said it's a confluence of things that is going on right now. The waning immunity, relaxing of mitigation by a lot of people, the cold weather driving more indoor activities, putting people in closer contact with one another. But indeed, lots there, and we will have lots more reporting on it throughout the day today on the air and online here on MPR News. It is about 11 minutes before 2 o'clock, and we're going to continue with programming from here and now in just a moment on a story that's going on in our neighboring state of Wisconsin. Stay tuned.
Support for this program comes from Cargill.